welcome to my channel, Reflections with Essie. And today we are going to be talking about how you can write a statement. Of course, all of us have had near misses at work and have been asked to write statements. And of course, you become perplexed. You don't know how to write a statement. Okay, let's discuss and let's see how we're going to do this in this video. Okay, so I'll be reading out my statement which I wrote some time ago, and I'll tell you about the background of the story of what happened. Okay, stay tuned. So I was working at this other clinic in Honolulu. Okay, so when I was on shift, there was one resident who had like epilepsy, had seizures. So the patient had come for palliative care, all right, end of life care. So the family would come. As you know, if people are going through the grieving process, they always want to find someone to blame if they lose a loved one. And that sometimes makes it very difficult for us nurses to do our job normally. So the wife of, I'm gonna call him Mr. Dube. Fine, I'm gonna call him Mr. Dube. So Mrs. Dube would come and spend as much time as possible in this clinic. It was a palliative care place. So she would spend, as you know, most policies would say if someone is like in their end of life and stages, you can spend as much time as possible with them. So Mrs. Dube would spend hours and hours on end set in her husband's room, and eventually she became accustomed to the routine of the clinic, the medication times, everything. So sometimes she would end up telling you, the nurse, what to do, how to do it, when to do it, you know, kind of disturbing you as you are working. All right, fine. So on this particular day, Nurse Esther was working in the ward, and the emergency call was sounded. Okay, fine. Then Nurse Esther leaves everything that she's doing. She runs, she goes to this room where Mr. Dube was to see what was happening. Mr. Dube was lying across the bed, like putting his head across, like against the wall, but his neck was like this because his head was against the wall, and it was quite big and already was struggling to breathe. I was like, okay, what happened? Asking one of the support workers, and they said, oh, he was having a seizure and stuff, but he stopped. Okay, so if he stopped, let's quickly put him into recovery position because he's not breathing well, because his neck is not extended, the airway is occluded. Then Mrs. Dube quickly jumps in to say, no, you have to leave him in that position. He's still having a seizure and you have no right to touch him if he's having a seizure. Then I was like, no, Mrs. Dube, he's already snoring to show that he has stopped having a seizure. And if you like, this is called post-ictal sleep. Like, it's the time when he's coming around, he's recovering from the epileptic seizure and stuff. They said no. Mrs. Dube throws a fit. She starts arguing, saying, you don't know anything. I've stayed with him for over 5 years and I've nursed him at home for 2 years in this condition. So you probably won't know better than me. Leave him. I'll tell you when to move him. I was like, no. My duty as a nurse does not allow me to leave him sleeping like this. So I have to move him and put him into recovery. And with all due respect, may you please step outside for a bit so that we get enough time to work and position him properly. Because I had known that she was going to cause discord and like poor coordination and stuff. She giving instructions, I giving instructions, you know. It wasn't a good sight. So I asked her to step aside. She goes outside. Then she quickly goes to the sister in charge to report that this is what your nurse did. She's moving my husband without my consent and stuff. And she came back. She said, I've spoken to the manager, to the unit ward manager. She said you should give my husband midazolam if he's having a seizure. I said he is not having a seizure. We are currently in the process of moving him to be comfortable so that he can recover and he does not aspirate or choke. Said no, you need to give him midazolam because I told you, he's still in a fit. So already I was like, okay. As soon as he got into recovery position, I left the room and left the wife with the support workers there. Fine. I went and spoke to the manager. Okay, this is what is happening. Why did you say I should give midazolam to someone who's not having a seizure? She said, okay, you are the nurse who is on the ground. If you can attest that he's not having a seizure and you are sure of it, please do not doubt your clinical capabilities. Your judgment is fine. What you decide is what goes, because you are the nurse. I'm not there in that room, so I can't say give him midazolam or not. Alright? But anyway, if you've got any challenges, talk to the senior nurse who's working with you. I said, okay, that's fine. I went, I told the senior nurse, we're having a challenge with Mrs. Dube. Mrs. Dube is doing 1, 2, 3, 4. Alright? Then she did not, the senior nurse did not respond. Her name was Anna. She did not respond. She just went straight to the cupboard, grabbed midazolam, and went and gave Mr. Dube, although he was not in a seizure. Alright. I went back to the manager. I told her, Anna is just going to give midazolam, but the man is not having a seizure. And not to talk of the side effects and the unnecessary administration of such a scheduled drug, and considering the side effects and whatever. I'm talking about my own reputation and how I'm going to seem in the face of Mrs. Dube. She'll think I'm incompetent and I refused with the medication. If I said no and Anna goes around and gives it, it shows discoordination between the two of us. Okay, she said, okay, that's fine. Are you okay to give me a statement of what happened? I said, but why? Okay, fine. I was already pissed. I said, no. Anna will give you the statement because she knows what happened. That's why she went to give me midazolam. If she thinks I'm incapable and incompetent, that's fine. I don't need to write a statement about that. I let it go. 6 months down the line, Mr. Dube has passed away and the family has buried him. They've moved on and everything. Bless his poor soul. He was such a very, very nice gentleman. Very nice, very polite, very respectful. I liked him a lot. And the wife, I don't even blame him. I know it happens when you've got a sick partner and whatever. You become, a lot will be going on. You just can't control yourself at times and you'll be desperate. You want everything to be done. If you think it's going to save him, you want everything to be done. Fine. So I understood what had happened. I just took it okay, that's fine. If it makes them feel better, like having the midazolam, even if he's not having a seizure, it's fine. So let them have it. That's fine. So I let it pass. I kind of blamed myself in the end. That, okay, maybe I should just have given it. But there were about 2 pens left. So I was like, okay, if I give him and he's not having a seizure, what about if he has a seizure and we don't have enough meds in stock and we've wasted and stuff, stock control, blah, blah, blah. But anyway, whatever makes the people happy, fine. So later on, 6 months later, everything is passed, everything is settled. I receive an email saying you were reported to this other Honolulu nursing board, blah, 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 blah. So you need to give a statement of what happened. The accusation is that you did not give medication. You withheld critical medication and you let a patient have seizures in front of you, blah, 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 blah. I was like, what? But obviously you can't argue with your mouth. You can't, you have to respond in writing. So I'm going to read for you what I wrote in this statement. Okay. I put a topic. I had to type it on a Word document. A statement. Location: Honolulu Clinic incident, suspected withholding of midazolam allegations. Suspected and allegations. Those are the key words. Alright? To note it's suspected, it's not confirmed. Hello? Allegations, it's alleged, it's not true. Fine. Date 3 May 1925. That's the date. Alright. My name is Mary Ann Trees, and I'm a registered nurse with an active Honolulu registration, and I worked at Honolulu Clinic from 1 January 1945 to 2 February 1937. And I, in my own personal capacity, I've been working as a nurse for 27 years to show my credibility as a nurse. So that's the introduction that you put. How credible are you? Are you a registered nurse? What are the qualifications that you hold to show your competence? All right. Then you go on to the next statement. The manager, Dorothy, asked me to write a statement about an incident which happened in May 2027, and I had asked for access to medical notes in the rota in order to get accurate details of the account of events, because it's been long. It's been more than 6 months, so I can't remember which dates I was working there and whatever, and medical records to see what was happening. All right, so that this was more of a disclaimer, so that if I put the wrong dates or if I put the wrong sequence of events, okay, it won't be like I'm lying, because obviously after 6 months you forget some of the steps. So already you put a disclaimer that I have asked for medical, and you should have asked for the records. Every time they ask you to write a statement, ask for medical records. Hold on. There's an issue that I got recently. They were saying we did not give medication on this day and stuff, so please tell us what happened. Then I was like, first of all, may I please have the mark sheet of the patient so that I can see like the dates and what I wrote on that mark sheet. Did I write not given? Did I write given, or what? Because obviously you can't remember all the patients and what happened off yet. So if you write a statement based on assumptions and you think you gave the medication, but on the mark sheet you wrote that you refused, that's going to be an issue of dishonesty or whatever. So first of all, ask for reference. Where do I refer for me to write what happened? Because you have every right to say you can't remember. All right. So therefore, but Dorothy said I'm not allowed access to the medical records. Therefore, I will write to the best of my abilities as much as I can recall. That's a disclaimer. I remember starting my shift on the day in question, and I received handover for about 34 patients, and of note was Mr. Dube. I said resident X, because you are not supposed to put residents' names, who was reported to have come for end of life at Honolulu Clinic. He had a terminal diagnosis of brain tumor and violent seizures lasting from about 30 to 60 minutes. This what I'm putting is true. I had gotten handover that he's getting seizures which are really aggressive. So that justifies why I had to withhold the 2 pens of midazolam, and I was not supposed to waste them, because already they told me that he has the potential of having aggressive seizures. So if he's not having seizures, why should I give the medication when a time will come when he needs the medication? Then around lunchtime, the emergency alarm was sounded by the carers in resident X room. I quickly went there to check what was wrong. I found resident X lying face up in between the bed and the wall. The support worker said that he had started having seizures as they were trying to move him into his wheelchair for lunch in the dining room. His wife was there as well. He was not having any seizures at all, but already in a deep sleep and snoring loudly. And ever since I nursed him, I never saw him have seizures that lasted 30 minutes, according to what his wife had claimed. He would have mild seizures, which would only cause his hand and fingers to twitch, lasting for about 20 to 30 seconds. And that was true. That's all that I had seen. His fingers would just have fine tremors like this. Those are the seizures that I only saw. Fine. I quickly instructed one of the carers to move the bed slightly away from the wall to prevent resident X's head from being entrapped. I then asked the carers to carefully roll resident X onto his left side so that he can be moved onto recovery position according to the care plan. You see, your point of reference in defense is the care plan or the policy or the hospital guidelines. Always refer to what the guidelines say. Did you do things according to the policy? If you did, please state that in your statement. He was snoring loudly, and because of his body weight, I was afraid that his tongue would roll back and cause him to choke. You see, patient's best interests. The carers complied with the instructions and laid resident X in recovery position. The wife started complaining and said that we should return him to supine position because he didn't look comfortable lying sideways and downwards. That was what the wife said. She asked me to administer midazolam to him because he was snoring loudly, which indicated a seizure, to his wife. I explained to her that resident X was not having a seizure and that he was now in post-ictal stage of the seizure, on his way to recovery and coming round. I also explained to her that midazolam was to be administered only if resident X was having an active seizure according to the care plan. And the care plan was saying only administer midazolam if he's having a tonic-clonic seizure, which lasts more than 5 minutes. That's when you administer midazolam. Anything less than that, you do not administer midazolam. That is what the care plan is saying. So you have to indicate that you know what the care plan is saying. And if you remember, I said that is now in post-ictal stage. I've really stated what was happening to the patient to show that I know the stages of epilepsy. You should be able to outline from aura up to the recovery stage and everything to show that you know. So if you are to write a statement and you remember vaguely, try to read as much as possible so that you know more about the condition, so that you do not implicate and strangle yourself with wrong wording, wrong statements, wrong nursing care. That alone can implicate you and make you a dangerous nurse. She kept on shouting that I did not know what I was doing and that she had nursed him well at home for 2 years. There were about 5 carers in the room, and some of them were agreeing with her that resident X should just have the dose of midazolam. The wife then instructed the carers to roll resident X onto the bed for more comfort. Like I'd put the resident in recovery position, and the wife there is saying, roll him back. I don't want him in that position. She's giving instructions which are going against what I have done according to the care plan. I told you that it was not advisable to keep him moving before he came round and he was at risk of aspiration. Because if you put him in recovery position, you give him a chance to draw and let out all those secretions which would have accumulated while he's having a seizure. Because when someone is having a seizure, he clenches, he can't swallow, he can't do this. So the secretions, they pull because of, So you have to put them by the side and all the secretions come out so that the airway is clear. She kept on insisting and giving the carers instruction. I felt that the situation was getting out of hand and decided to escalate the matter. Already, if you realized when I started the video and gave my oral translation, oral narration, it's quite different from what I've written. That is why you're supposed to have medical records, so that your story is consistent with what you said before and what you're going to continue to say. So you should always refer to them to the care plan, to the notes about whatever it is that you're going to write. So I then left the room and went to Sarah, the the clinic manager, to tell her of the incident. And she said, don't ever question your clinical judgment. You're a competent nurse and just make sure you follow the care plan. She also said that if I'm uncertain, I should ask Anna, who is the unit manager, to assist me since she was my immediate supervisor. The care plan did indeed state that you should only give Miss midazolam dose if the seizures lasted more than 5 minutes. I could not give him any midazolam since he was not having any seizures. I've clearly stated it and reiterated it. This is the third time I'm mentioning it in the statement. I then went to Anna, who was the manager, and told her of the incident. She did not respond. She just went to the cupboard and took one pen of midazolam and went and gave it to me, resident X. I felt really hurt by the lack of support and having my clinical judgment being undermined by the wife and my manager as well. You have to say how the incident affected you emotionally, professionally. You have to say, because the statement is a chance for you to express yourself as well, because they want to hear your side of the story. I did not follow Anna back to the room because I did not want to upset the already unsettled wife. I documented the whole incident as usual. Just I would document all his epileptic fits on the seizure chart. This is the daily nursing notes. So I documented everything. I saw him twitching his fingers for a few seconds, tried to roll him to the side. The wife objected and put him back in this and this and this, and escalated the matter. The sister in charge then gave me midazolam and all the drama is settled, blah blah blah. Record everything. You never know when it's gonna come to bite you. Because here I was referring and said I wrote in the daily notes. So if you write in a statement that you wrote in the daily notes and they go to the patient's notes and they don't find that entry, they'll say you are a fraud and you are lying. That makes your whole statement and story less credible. So always refer to the care plan, refer to the patient's notes, refer to the entries that you have made, refer to the verbal communications that you made. If you gave hand over to Nurse Mary and told her that, you should also state in your statement that at 17:45, because I was about to knock off, I gave hand over to Nurse Mary and told her that. And she acknowledged, she responded by saying, yes, I will do it. I also wrote it in the handover notes. You would have finished. Then I was like, I waited for Anna to come back and asked her why she had gone ahead to give resident X the medication, yet he wasn't having a seizure. Anna said at times like this, it is always best to comply with what the family wants instead of fighting with them. She said resident X is dying anyway, so it was better to give the family a feeling that we are doing our best and just give the medication, even if it wasn't needed. That was what she told me. And already I'm casting, like, I questioned, because as a nurse, it is your legal obligation to question malpractices or what you feel is unethical or is not professional. You should not keep quiet if you see something being done. You've got the duty of care for the patients and to ensure that they get the best and accurate care. So I had to ask why. I felt that Mary was being sensible and compassionate, and that was just doing it. I felt that Anna was being sensible and compassionate and was just doing her best to calm a tense situation. Of course, the wife settled and resident X came around 10 minutes later and he was taken outside his room for lunch. I acknowledged that, because if you're working in a team, it's part of conflict resolution. That's the avoider style, win-lose situation. In this scenario, I lost the battle, but the wife won. She was happy, she got things her way. And Anna also won because she had things her way, even though it was wrong. So this is part of the conflict resolution strategies. Win, lose, lose, win. So in this scenario, I accepted defeat and all peace reigned. And the patient was happy and comfortable. Fine. However, there were quite a number of incidents when the wife would always question my clinical judgment. I then realized that when she had said that resident X had 1 hour long seizures, she was referring to the post-op ictal sleep. Resident X would only twitch for about 10 seconds, then fall into a deep sleep for 30 to 45 minutes. I tried explaining to her the pattern for epilepsy from oral stage to recovery. She would not listen. I tried to do my job as a nurse, which is to give health education. I then asked Dr. Moyo to talk to her and explain to her. Dr. Moyo then came on a Thursday afternoon and had a meeting with the whole family and explained to them the epileptic manifestations and medical management, and that resident X was approaching his terminal stages of his illness. I documented all these events in his daily notes. And of course, when the doctor came for the doctor's round, I documented all that because I was the one who had called the doctor. That Dr. Moyo, please come and talk to the Dube family. They're having a problem accepting that midazolam is not going to help if someone is not having seizures. So the doctor came, explained to the family. I wrote all that down. It was all in the notes. All these events were in the notes. I have tried to recall this incident and have yet to be as accurate as possible. I could have mentioned the exact dates and times and the carers' names involved by name, but I am afraid I cannot remember offhand since I could not be granted access to the rota and medical records. This is a silent disclaimer that if there are any mistakes, please pardon me. I can attest that I have said the truth about the matter and have always practiced to the best of my abilities in line with the set care plan for each and every resident under my care. Thank you. Nurse Mary Ann Chimoti. Then I put my email address and phone number. So, I hope this helps you when you are stuck and you do not know how to write a statement. But the greatest remedy of all is try to be as honest as possible, so that if you made a genuine mistake, you can have a chance to reflect and see where you went wrong and actually make better decisions next time. Because we don't know everything. We are nurses, we are still learning. We learn every day. Nursing is dynamic and each situation is treated differently. And at this point in time, I would say what senior nurse N did, like giving them midazolam to silence them and whatever, that was a way of solving the issue, because at times fighting will not help in any way. We want what's best for the family, we want what's best for the patient. Patients come to palliative care for comfort and peaceful dying, so we need to assist them with that. There are so many ways of doing it. What Nurse N did was one of them. Not sure if it's legally acceptable. I'm still trying to read and learn and try to find out if she did the right thing. But to me, medically it was wrong, because you only administer medication if it's needed. But of course, I remember when we were reconstructing syringe drivers, we do put midazolam. Yeah, we do, even if they're not having seizures, because it has got sedative effect and relaxing effect. So it's part of the palliative care. It's a muscle relaxing and whatever. Okay, that's fine. So I guess she was justified to give it. But whatever the case, it wasn't necessary to argue and fight about it at that time. We had to put the patient first, the patient at the center of it all. So by writing, I have put both sides of the story, my own side of the story of why I refused to give the medication, and I've also acknowledged why Nurse Mary, Nurse Anna gave the medication. So if I'm to learn from the scenario, I've learned that what I did was right, what Nurse N did was right. So it's if anyone who's reading my statement will see that I'm acknowledging both interventions, and I've learned from the incident, and I've tried to recall as much as possible. So please try to be honest in your statements. Do not add roiko. Do not try to put situations like, hey, I did this, if you did not do it, because there are always ways of finding out if you didn't do it. And most importantly, what is not written is not being done. If those actions of yours that you said you did are not documented in the nursing care plan, it means you did not do those things. So point number 2, if ever you are nursing a patient, try to document all the care that you did. You'll discover that mentioning that you gave the patient a sip of water will either implicate you or either act in your favor one day when the day of reckoning comes. So please try to record all the care which is given to the patient. I remember in 2014, when I was working in South Africa as a nurse, there was a patient who had developed a catheter infection, and that was about 2 months later after the patient had been discharged. The infection control nurses came in the matron to audit the notes for the patient, and when I inserted the catheter, I documented step by step that I cleaned the meatus, I washed my hands aseptically, I put on sterile gloves, I put on the catheter aseptically, and every day when the patient was in my ward, because in South Africa you would work 4 or 5 days consecutively in that same ward, so the patient was directly under your care, because you'd be working alone on that ward. You'd be having your own patients, there is no nurse to help you. So in all the 4 days the patient stayed there, I documented that I washed the patient, I did catheter care aseptically, I used this solution to clean the catheter. So it was there. That is when I learned that you need to document. These things will come back to bite you. So if I had not documented the catheter care that I had done, I know I would have been blamed for causing the catheter associated infection. So always try to document. Most importantly, try to do the right thing. And when you do the right thing, make sure you document what you have done. It's not just documenting, but do the right thing. Provide the best care to the patient and document. Then the other thing, if you can't remember, please tell them. Do not write lies. Do not try to remember bits and pieces. Tell them, I can't remember. Like I said about that medication issue, they asked me to write a statement. I told them, I cannot remember. Please give me the documents, the medication administration report, so that I can remember what happened. And they said, no, we can't give you those. I said, okay, that's fine. I'll only write if you give me those. And the case was closed. Because I cannot remember whether I gave the medication or not. Because I see a lot of patients in different clinics. So I would be lying to say I remember if I gave John medication on the 7th of January 1953. I would be lying completely. So I cannot remember. So always ask for the records where possible, or try to talk to them so that they can help you. A statement is not always, does not mean implication. Sometimes it's there to exonerate you, to give you a chance to explain your side of the story, to give you a chance to be heard. So always try to write it to the best of your ability. But if you can't remember, yes, you can't remember. I hope I've helped someone on how to write a proper statement. I will try to continue researching about other things that can help improve the nursing profession. Have a good night and enjoy yourself. Until next time, just press the subscribe button, like the video, and share it with another nurse whom you think would benefit from this video. Bye. Good night.